Hi, I'm Dr. Fredrick Echols, Acting Director of Health for the City of St. Louis. The Department of Health continues to receive numerous questions related to COVID-19 from St. Louis residents. This week, we received questions from individuals in 8 zip codes throughout the city. The residents were all bashful and asked that only their initials and zip code be used. D from area code 63111 asked, is it true that a doctor's note regarding returning to work supersedes a positive COVID-19 test result? According to the Centers for Disease Control and Prevention's guidance for returning to work after testing positive for COVID-19, employees should not return to work until they meet the criteria to discontinue home isolation and have consulted with a healthcare provider and state or local health department. The City of St. Louis Department of Health adheres to isolation and quarantine guidelines established by the CDC. AC from area code 63113 asks, are younger children tested for coronavirus the same way adults are? Viral tests are recommended to diagnose COVID-19 infection. Testing strategies are the same for adults and children. I recommend you prepare your child prior to going to be tested. This includes letting them know what the medical staff will be wearing and why. For example, you will see people wearing gowns, gloves, and masks. This is to help keep everyone as safe as possible. You should also let your child know what the nasopharyngeal swab, a tipped applicator used to collect the sample, will look like and what it will be used for. You might tell them, someone will use a long swab to rub the inside of your nose for about 10 seconds. This swab will be sent to a doctor who will learn more about your body. SH from area code 63110 asks, are there any tricks to keeping your eyeglasses from fogging up while wearing a face cover? If your eyeglasses are fogging when you put on a face mask, it's because warm, moist air you exhale is being directed up to your glasses. To stop the fogging, you need to block your breath from reaching the surface of your lenses. One way to accomplish this is to wash your spectacles with soapy water, shake off the excess, and then allow the lenses to air dry. This leaves a thin film on the lenses that reduces fogging. Another tactic is to consider the fit of your face mask. To prevent your exhaled breath from reaching your glasses, place a folded tissue between your mouth and the mask. The tissue will absorb the warm, moist air, preventing it from reaching your glasses. Also, make sure the top of your mask is tight and the bottom looser to help direct your exhaled breath away from your eyes. CD from area code 63103 asks, if you get the flu vaccine this year, will that work for coronavirus? While the flu shot won't protect you from getting COVID-19, the Department of Health definitely recommends you get a flu shot. Most people older than 6 months can and should get the flu vaccine each year. Doing so reduces the chances of getting seasonal flu. In the event you do get infected with the flu, your symptoms are more likely to be less severe and your clinical course shorter. TB from area code 63104 asks, when the COVID-19 vaccine is ready, will it be free to the public? Public health experts are urging U.S. leaders to make a coronavirus vaccine available to everyone, not just those who can afford it. As more information becomes available, the Department of Health will inform City of St. Louis residents. DW from area code 63103 asks, there was a testing event at City Hall for city employees earlier this year. Are city employees required to be tested for COVID-19? A testing event was held for city employees earlier this year on the City Hall parking lot. All city employees were invited to attend that event. City employees can check the Department of Health's website for a list of federally qualified health centers providing free COVID-19 testing. Any person that has COVID-like symptoms and is concerned that they have been exposed to a COVID-positive person should get tested to learn their COVID-19 status. Knowing your status is critical to protecting your health, the health of your family and friends, and the community at large. CS from area code 63118 asks, public bathrooms typically have paper towels or blow dryers to dry your hands after washing them. Which one works best to reduce the spread of the virus? Hand hygiene is a critical part of slowing the spread of COVID-19 and other communicable diseases. The best way to ensure you remove the coronavirus that causes COVID-19 from your hands is to wash them for at least 20 seconds with soap and water and to dry them thoroughly. A key component of hand washing is thoroughly drying your hand. The Centers for Disease Control and Prevention recommends using a clean towel, an electric hand dryer, or air drying. Once again, the key is making sure your hands are thoroughly dry. Several studies have been conducted to determine the hygienic efficiency of electric dryers and paper towels. Overall, results have indicated that residual water is more efficiently removed from hands by cloth towels. In addition, it has been shown that towels are more effective in removing bacteria from washed hands. JP from area code 63108 asks, the virus is scary and stressful. Disruptions from my pre-virus routine have been stressful. Do you have any tips for relieving stress and anxiety caused by coronavirus? Know that it is natural to feel stress and anxiety during a pandemic, especially when there are so many unknowns. Take media breaks. Constantly watching the news or checking your social media can be overwhelming. Be extra conscious of taking care of yourself. Get ample sleep, exercise, and eat well. Please avoid consuming alcohol or taking drugs to handle your stress. Be sure to stay in touch with family and friends using technology. You can also consider joining a virtual book club, faith or support group, or workout team. Also, the behavioral health specialists are available to assist persons who are experiencing increased stress during these difficult times. To access this service, which is provided at no cost, you should call 211 and the United Way of Metropolitan St. Louis will work to connect you with a behavioral health specialist. I'd like to thank everyone who sent questions and all of you for tuning in. Be sure to tune in next week for more critical public health information. I want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.